Good morning. Let's try that again. Good morning. I'm Ron Allen with the Department of Health and Human Services. It is my esteemed pleasure to welcome all of you all to the very first ever My Brother's Keeper White House Men's Stakeholder event. This is a huge moment for us. We've had the 90-day report just come out, as well as June being Men's Health Month. And so we had to get all of you all, our stakeholders from all over America, to come in and talk with us, open up the dialogue, and bring some serious attention to My Brother's Keeper and how it intersects with men's health. We would be remiss to not start this with the person at the vanguard of My Brother's Keeper. He's the chair of the task force, as well as the cabinet secretary for White House, Broderick Johnson.
Good morning. How's everyone? Great? It's a great day. It really is. It's a great day just to be able to be here, first of all. And second, to be here representing our great president and the opportunity to talk about My Brother's Keeper and to kick off this incredibly important discussion about how this being June being Men's Health Month, and also how that therefore ties into My Brother's Keeper, which, as Ron mentioned, I am the chair of the task force. It's a task force that was created by the president not too long after I'd actually arrived here. I started at the White House on February the 17th, and we launched the My Brother's Keeper initiative on the 28th. And so the timing was great. There was a snowstorm in between, so it was like the snowstorm was waiting for me to come on board so I could be there to help launch this incredibly important initiative. In addition to the work that I do as chair of the task force, I'm also the cabinet secretary for the president, and that means simply that I'm President Obama's main liaison to all the cabinet secretaries. It doesn't mean I get to boss my dear friend Eric Holder around. You can tell him that I said I don't. But I'll get to work with Eric Holder, who I've had the pleasure of knowing since the days that we got involved in an organization here in Washington, D.C. called Concerned Black Men. A number of other friends of mine and people who work in the administration were also involved in those very early volunteer efforts going back a little bit over 2 decades. For me, though, to be able to have the opportunity with everything I've been blessed to do in my career in Washington, but to be able to have this as a principal part of my responsibilities on behalf of the president is like a dream come true, quite frankly. Sure, the challenges are enormous. We will talk about a number of those things, of course, throughout the day. But as the president said back in January, he was not going to let the inactivity on Capitol Hill, the partisanship get in the way of being able to get things done. Therefore, he was going to use his pen and his phone, that is his ability to sign executive orders, to issue proclamations, to sign presidential memoranda as his pen authority, but then also to use his power to convene people, to convene like this gathering of people in order to move the country forward addressing issues, particularly from the standpoint of what the private sector can do along with the federal government, with state and local agencies, and also with the nonprofit sector, businesses, and many others in order to make change real in this country. So let me talk at first about this moment today and why it's so important, and then relate all of this, of course, to My Brother's Keeper and the report that we've issued. Most importantly, though, the work that lies ahead. The purpose of this event today, of course, is multifaceted. Again, we'll be talking about how to improve the health and well-being of especially boys and young men of color across the country. This event's a great opportunity to focus on the power of prevention, that is to heighten awareness among men and their families of preventable diseases like heart disease and high blood pressure and diabetes, which often take, as we all know, a significant toll on men, especially men of color. On average, men are less likely than women to have health insurance and to make recommended preventive visits to doctors. Unfortunately, because of the new health care law, more men now have access to those preventative services like flu shots and blood pressure screenings and smoking cessation programs at no extra cost. This access, of course, is especially important at a time when the health statistics for minority men in the United States is alarming. You all know these statistics. Let me just mention a few. First of all, heart disease is the leading killer among most racial and ethnic minority communities in the United States, accounting for 24% of all deaths in 2010. Hispanic men are 14% more likely to have a stroke than the general population. African American men are 1.5 times more likely to be diagnosed with diabetes. American Indian and Alaska Native men are 2.5 times more likely to be diagnosed with diabetes. Asian American men are 1.2 times more likely to be diagnosed with diabetes. And African American and Mexican American boys 6 to 11 years old are 1.3 times more likely to be overweight than white boys of the same age group. But look, these statistics, as dire as they are, of course, don't have to be the end of the story, and they are not. Today, 10.2 million Latinos, 6.8 million African Americans, nearly 2 million Asian and Pacific Islanders, and over 500,000 American Indians and Alaska Natives have new opportunities for affordable health insurance thanks to the Affordable Care Act. Also, 8.2 million Latinos, 7.3 million African Americans, and 3.8 million Asian Americans with private health insurance now have access to expanded preventive services with no cost sharing. And perhaps most importantly, 913,000 Latino, over 500,000 African Americans, and 121,000 Asian American young adults between the ages of 19 and 25 who would have been uninsured now have coverage under their parents' employer-sponsored or individually purchased health plans. So there's been tremendous progress made through the Affordable Care Act and other initiatives to make sure that these disparities are being addressed so that people have access, especially men of color, have access to preventative health screenings. And so it's going to make, of course, and it's already making a huge difference across the country. Let me talk about how this then all relates to my brother's keeper. As Ron mentioned, we issued a report to the president on May 30th. We were given 90 days from the date of the launch of the initiative to get a report that looked across 18 different federal agencies that have programs and initiatives that particularly affect the lives of boys and young men of color, but which are universal in that all children, all young people in this country are covered under those programs. But we know because of disparities, if we looked at those programs and we could figure out what really works effectively, we could highlight those things, but also strengthen those things in a way that would, particularly because of the disparities, have a great impact on boys and young men of color, but would also improve the lives of all young people in the United States. For example, in our report, there isn't a single recommendation that says that this recommendation is exclusively to address the needs of boys and young men of color. That is an incredibly important point I want to stress. That is that because of the disparities, again, we know that certain programs have a disproportionate effect, a positive effect on boys and young men of color, but that all children in the United States can be assisted. So we looked across all these federal agencies and we came up with a report that has about 60 recommendations in it across many agencies, especially the Departments of Education and the Department of Labor and Department of HHS, to address, again, the health disparities, but also the educational disparities, especially that affect the life outcomes of boys and young men of color. Let me talk a little bit about some of those disparities. There's, for example, a 30 million word gap. When I first heard this, I was just incredibly struck by this. But for children who grow up in impoverished homes or grow up in poverty, between the ages of 0 and 3, those children hear 30 million fewer words than children who grow up in affluent circumstances. 30 million. Then you also, of course, think about the quality of the words as being important as well. Now, this is, of course, a social issue, it's an educational issue, but it is also a health issue. That's why just yesterday, the American Pediatric Association issued a recommendation. They did a report and issued a recommendation that it is critical to the well-being of children that a parent reads to that child on a daily basis between the ages of 0 and 5. Again, this is a health-based organization that made that recommendation yesterday, and it certainly ties into what we had come to understand about this 30 million word gap. By the time students have reached the 9th grade, 42% of African American students have been suspended or expelled during their school years, compared to 14% of white male students. While black youth account for 16% of the youth population, they represent 28% of juvenile arrests and 37% of detained populations. While just over 6% of the overall population is African American males, they account for 43% of murder victims in 2011. We spent a lot of time looking at how we can break the school-to-prison pipeline. Again, it's an issue of fairness and justice, but also in terms of it being a health issue. When you think about the health of families, the well-being of children where their parents are incarcerated or are constantly in trouble and have a difficult time being able to land a job. Also, in our report, we look at early health screening issues and the fact that asthma and diabetes, of course, disproportionately affect children of color in their early years, but those things we can screen for earlier, as you all know. So we need to do those screenings so these children are better prepared to enter school, especially in preschool and early elementary school years, but even beyond that. So with these disparities, again, in mind, the president looks at all of this way. It's a core American value, and that value is community. So when we launched My Brother's Keeper, it was focused on that core value, which is what can the community, not just the government, but the private sector, state and local governments all do to enhance the life outcomes for boys and young men of color especially, but to enhance opportunity for all children across the United States. So we're doing our part again. We issued the report. When we met with the president to talk about the report, he said, Broderick, and Jim Shelton, who works with the Department of Education as a deputy secretary, who's an outstanding leader as well. He looked at us and he said, this report's great, but then what are we going to do to implement the recommendations in this report? Because we don't want to just have a report here that sits on the table here at the White House or in other places or people can access on the website, but no one knows how to address these issues. So we are already starting to address these issues, but the private sector is also addressing these issues. There are, for example, a group of 10 foundations that just about 10 days ago released a report that parallels the report of this administration, looking again at the challenges, the disparities that especially affect boys and young men of color, and they are investing over $200 million more in addition to programs they already do across the country to address these things. Again, it's in parallel. There's also a parallel effort that's being led by Magic Johnson and the CEO of Deloitte & Touche, it's not Deloitte, it's now just Deloitte, Joe Echevarria, who is also leading a business effort where we will have businesses and faith leaders also contributing on the private sector side to address these disparities and improve the life outcomes for boys and young men of color. Back to our report just for a second. We have a really good idea of what works. We also have a very good idea of the important milestones in a life of a child or a young man that's really important. There are 6 key ones, and our report focuses on those 6 key ones, and the private sector work is also tied to at least these 6 and then others. But let me just mention these. First, getting a healthy start and entering school ready to learn. This is, I think, in addition to the 30 million word gap, this was the most shocking fact that I heard as we looked at the report. You know, in 2011, 2012, 4,000 preschool children were suspended or expelled from preschool in the United States. 3- and 4-year-olds. That's just almost impossible to imagine how someone could suspend a 3-year-old child from preschool, but it happens, right? And it's not to say that there are mean-spirited teachers or people who run these preschools. That's not it. It's just they don't seem, in too many cases, to have the tools to figure out what to do with especially a child of color who is misbehaving a bit at 3- and 4-year-olds. Now, I remember when my kids were 3 and 4 years old, trying to figure out their behavior, what motivated them, why they woke up the way they did on a given day. But the idea then of suspending a child from preschool and the impact that has on the family, imagine being called at work and being told you need to come and get, little Kenny because he's expelled. The impact that has on the employment situation of the family. So, knowing that, we have recommended in a report, and it doesn't seem like a tough recommendation. It's not something the federal government can order, but state and local school districts can do better training and the like to eliminate any suspensions or expulsions of children from preschool across the country. We should certainly be able to achieve that in fairly short order. The second area is reading at grade level by third grade. There are very clear metrics about the impact of what happens to a child who is not reading proficient by the third grade. This is where as early as the third grade, the whole issue of the school to prison pipeline comes into play, right? There are predictions that people make, including, I understand, even some who are involved in the prison industry, of figuring out what their populations will look like based on what is happening to kids in the third grade. We have to break that. I was in Detroit. We've done a number of listening sessions all over the country, and one of them was in Detroit. While we were doing this report, we didn't want to just be, of course, sitting here in Washington, meeting with the agency heads. We need to go out and listen to what people say and do in different communities. In Detroit, I was on a panel with 4 young men. They were probably ages 16 to 18. And there were 2 African Americans and 2 Latinos. 2 of those boys who don't go to the same school said in their remarks that they were greatly impacted by reading Michelle Alexander's book, The New Jim Crow, which is about the school to prison pipeline. And they were just so motivated by the fact that that book laid out for them what can happen if they stay in that pipeline, if they don't figure out, really through their own ambitions, through their own opportunities, but also in making sure that when something happens to them in school that could lead them, again, on the path to prison, that they don't intervene to assert their own rights or their parents aren't involved. But I was really struck by that at this age, these young men were reading a book that's quite sophisticated and, again, is important to understanding how kids can avoid being on that path to prison. The third area we looked at is graduating from high school, ready for college and career. And that goes to young men, of course, getting through high school, not being suspended or expelled, and then also being able to get into college, to take the AP classes and other things that are important to making that progress. Another area is successfully entering the workforce, kind of the same issue there in terms of preparation, to get into the workforce, to have the skills, to have the training, to take advantage of apprenticeships. And then finally, keeping kids on track and giving them second chances. This issue of reentry is a huge one. And another listening session we did in Philadelphia a couple weeks ago, listening to the stories of a group of young men who have gone through the juvenile justice or the prison system. They're out, they're trying to change their lives, they're trying to find jobs, and yet they find it extremely difficult, as we all know. First of all, because in some cases they have tattoos up to their necks. Right? So what do you tell them they do about that when they go for a job interview? Well, maybe it ought to be in a tech industry somewhere, right? Or somewhere where they can telework. But certainly to try to go into, say, an office situation is not going to work. But what I was struck by was how optimistic these young men were and how they wanted to be able to care for their families and be able to improve their lives. There's a lot of optimism in this country. We just have to make sure that when these young men are ready to work hard, that they have the opportunities because we have done what we need to do as adults, whether it's in government, the private sector, or wherever else, to have an impact on their lives. So in closing, let me just say that we appreciate everything that's being done across the country. The President is committed to this initiative throughout the rest of this administration and beyond. The urgency of the situation cannot be denied. So there's an urgent sprint to try to improve the lives of these boys and young men of color, in fact, all children in this country. But there's also a marathon. We're not going to solve these issues overnight. We have to stay committed for the long term. And I know this President, this First Lady, and this administration are as well. So at this time, I'd like to invite our panelists to the stage for today's panel, which is titled, My Brother's Keeper, Moving Forward, Men of Color and Health. This is a short title, Marketplaces, Prevention, Disparities. I'll turn it over to Marlon Marshall. Is Marlon here? My colleague Marlon Marshall, the Deputy Director in the Office of Public Engagement. Thank you all very much.
Hi, everybody. Oh, rest of our fantastic panelists, come on up, come on up. How's everybody doing today? Good. Come on, how's everybody doing today? All right, all right. Thank you all for being here. As Broderick said, my name is Marlon Marshall, Deputy Director in the Office of Public Engagement here. Very excited about today's event. Thank you for being here. Thank you for joining us. This is, as Broderick said, the cross-section of men's health and the initiative on My Brother's Keeper that we're doing is something that's very important to the President and this administration, and to make sure that we're reaching out there for not only young men and boys of color, but for everyone to talk about some of the health disparities, talk about the Affordable Care Act and the success of the first open enrollment period, but what we need to do for the second open enrollment period and moving forward. And to talk about a lot of the initiatives that we're doing now on how, targeted towards young men and boys of color, but how that will help the entire country and every single person in this country is something we're excited about. And I have a fantastic panel to continue that conversation with. So before we start, though, and before I introduce the panelists, I do want to say that we're going to make sure this is an interactive conversation. We're going to be taking questions from the audience. You will see folks go around and get questions from you, and we'll put them on a note card, and I'll get a chance to ask the questions that are coming from you up here as well, too. And we also have our live streaming this, so welcome to folks who are watching this online. And we'll be getting questions from you as well, too, and I'll be reading those and asking the panelists. So thank you again for coming. I want to introduce our panelists. First, we have Dr. Samuel Ars, who's the chairman of the National Hispanic Medical Association. We also had Gautam Raghavan, who's an advisor in the White House Office of Public Engagement. He's fantastic. I'm biased because he's in the White House Office of Public Engagement. Then we have Marco Davis, the Deputy Director of the White House Initiative on Educational Excellence for Hispanics. And we also have Dr. Wesley Clark, who's the Director of the Center for Substance Abuse Treatment at the Substance Abuse and Mental Health Services Administration. So why don't we give our panelists a round of applause. The first question I have for our panelists is, why are healthy habits and choices so important to young men and boys of color? So I'll just start next to me with Dr. Ars, and we'll just move down the line. Oh, sorry. And we're sharing the mic.
Buenos dias. Good morning. That'll be my extent on Spanish this morning. I'll throw out a disclaimer, and it's that I am a practicing family physician, so I am very much passionate about preventive health and health in general to our communities. I think one of the things that we need to address is that it is so important to bring awareness to men because of one thing that I see almost every day, and it's that men tend to come in later and tend to look for excuses to come to get to seek advice, medical advice, and to get regularly scheduled appointments. And that leads us to diagnose things a lot later. So I wear two different hats this morning. I am chairman of the National Hispanic Medical Association, representing about 55,000 physicians across the country. And I am also honored to say that I am the only minority primary care physician on the national board for the American Diabetes Association. So there's huge disparities in diabetes, as we've heard this morning already. And it's because, and it tends to attack our communities, the communities that are represented here this morning. The projected numbers seem to be that if we don't turn this around in a quick way, out of every 3 blacks, 1 will be overweight and diabetic. But in Hispanics, out of every 2, 1 will be overweight and diabetic. So we've got to look for ways of turning that around and encouraging men and young men to be able to become involved in their own health care. I'll throw out one more point, and then we can discuss later all the other stuff. I think we need to bring awareness to men in this country to take care of their health so they can then go out and find a young man and mentor him, but make sure that your health is okay first. And then go out and mentor a young man so that he can become that male that he should be eventually. And we can discuss the disparities that occur. Cancer is much higher in blacks than in other groups. We've got to turn these things around. Death rates from cancer much higher in blacks than it's about 50% of every black that is diagnosed with cancer in this country will die. Hispanics is about 19% or so. So the disparities are huge, and we need to look for a way of turning that around.
Great. Good morning, everybody. My name is Gautam Raghavan again. I direct outreach to the Asian American Pacific Islander community, as well as the lesbian, gay, bisexual, transgender community for the Office of Public Engagement. And I would just echo, I think, what the doctor said, which is that we see very similar health disparities in both AAPI and LGBT communities. I know we have some subject matter experts in this audience, including our friends from the Health Forum here, so I won't cite statistics because they'll probably correct me. But I think within, for example, certain Asian American, Native Hawaiian, Pacific Islander communities, we see similarly high rates of diabetes, blood pressure, obesity, and so we know that those exist and that we have to do some work there as well. And similarly with the LGBT community, specifically with gay, bisexual, and transgender men and boys and men of color, we see other kinds of health disparities. And sometimes, in fact, just earlier this week, I believe the Surgeon General issued a statement about the smoking rate amongst young LGBT folks. It's about 33%, which is, I think, about twice what it is in the general population. So we know those disparities exist. And I will answer a slightly different question, which you didn't ask, Marlon, which is not just the importance of getting to folks while they're young, but also how we do it. And I think we have to think about that very sort of strategically and intentionally. And for example, with the API community, it's going to be important as we do this work to remember that we are not a monolithic community. We're many different types of people in the big API umbrella. Keeping in mind language access is incredibly important to members of our community who don't have that access. I think it's also important in thinking about how we reach gay, bisexual, and transgender young men and boys of color to think about cultural competency as well and what kind of experiences a lot of these folks are facing at home, in their places of worship, at school, and making sure that we're reaching them with language and understanding that they need to get on board. Oh, yeah.
Good morning, everyone. Two things I'll share. One, a resource for folks who may not be aware and familiar. There are actually 5 other initiatives similar to our White House Initiative on Educational Excellence for Hispanics, and so for those of you who are not aware, I would encourage you to look for them, to reach out to them. They're really strong resources, and or go through me. Happy to share with you as well. There's an initiative on educational excellence for African Americans. There's a White House Initiative on Asian Americans, Pacific Islanders, White House Initiative on American Indian and Alaska Native education, as well as a faith-based and Neighborhood Partnerships Office, and finally the White House Initiative on HBCUs. And so they all do similar work to what I do, and we all sort of, as partners and colleagues, sort of try to carry each other's work forward and share it with communities, especially in places like this where people may be able to take advantage. The second thing I want to mention in response to Marlon's question, in addition to the wonderful comments already shared by my panelist colleagues, is, again, as you all well know, it's important to sort of bear in mind, and again, you do this in your work, but I think it's worth sharing with people who particularly specialize in particular areas, that life in communities doesn't happen in the silos in which our systems are structured, right? And so, for example, as a case in point, given that a lot of our focus in our mandate is on education, one of the reasons we're here is that because we know that there are other factors that strongly influence each other in a young person's life. So health and healthy habits are particularly significant on the education of a young person. Everything from nutrition, again, that's something we know as a society. That's why we have free and reduced school lunch programs. That's why we have summer feeding programs. That's why we have breakfast programs available, because we know that a hungry child learns less, is able to retain less information, and so on. But it's also important to realize that, again, health and healthy habits, and again, with the disparities, when you start looking at the data, there's important need to focus on communities that are underserved, that are under-resourced. And there are places, again, where we can make some real fixes. There are systems in place already, and there are services and there are supports, for example, to provide vision care for low-income children and students, to provide dental care. Oftentimes, it's just a matter of connecting those dots. It's getting those students, again, there's things like transportation, things like the workday of the parents, who make it difficult, if not impossible, often for children simply to get to the point of getting to the appointment, which they can then get a free prescription and then often get eyeglasses if they're needed, paid for by a healthcare system, right? And it's often just a matter of connecting the dots, of getting the students all the way through that process so that they actually receive the glasses. Because again, it becomes obvious at the end of that process where you realize that without the glasses, the students are not going to be able to learn as much. And then lastly, related to the in this same kind of interconnectedness piece, it's important to also realize sort of some of the broader, perhaps slightly less tangential kind of aspects that influence life in terms of health and healthy habits, which is part of why there is such a need for programs like this that really provide supports in a comprehensive and strategic way for young people, for boys and men of color, for all children, because there are factors like stress. And increasingly there's a lot of research and data coming out of the healthcare field talking about trauma, about the fact that actually students are exposed by being exposed to communities where there's high levels of violence, by being living in communities where there are high levels of poverty. Not only are there stressors on them, which again impact their learning, impact their nutrition, impact their habits, but also even in fact that there's a need to approach it in terms of a trauma and healing aspect that really can yield really significant results in terms of improving the life outcomes for those children and their families.
Yes, thank you. My panelists have addressed most of the critical issues. Mr. Davis pointed out the issue of trauma, and I wanted to stress that we also have to take into consideration the context in which boys and young men of color operate. So the themes that popped into my mind in response to this question is bullying, trauma, depression, anxiety. We need, as was mentioned, the issue of mentoring in order to deal with the issue of alcohol and drug use, because these are things that we know that if you start using drugs early, you start drinking early before the age of 15, then you're more likely to develop subsequent problems as you age. And these things also interfere with learning. I know there's a lot of popular music which, shall we say, revere the use of substances like marijuana and other substances, but what we have to deal with is that we recognize that they cause impediments in the learning process. And so if we're not dealing with the bullying that occurs, particularly for those who feel that they're out of sorts, the issue of LGBT was mentioned. That's a population that is frequently endures stereotypes, stigma, taunting, bullying from classmates, because what we don't have, in order to pursue healthy habits and choices, we need a community environment. As was mentioned, that the community doesn't embrace healthy growth and development, then what we have is a group of individuals who adopt dysfunctional behavior in order to cope with a community. So part of the effort is setting the standard of healthy habits and choices by getting the parents to understand that they themselves have to take care of themselves, as the doctor pointed out, and that in so doing they communicate that message to their children, whether they're boys or young men of color or girls and women. The key issue is that the family embraces healthy habits and healthy choices, and the community embraces healthy habits and healthy choices. That makes it easier for the individual to embrace healthy habits and healthy choices.
I agree. And kind of playing off that, we talked a lot about, again, healthy habits and healthy choices and why it's important. I love the point you just made specifically about family. One of the things obviously that's been important to the president is for make sure people are covered, and if they, part of the process of getting health insurance too is just the educational process as well too. So, question for all of you, Dr. Clark. Let's start with you. The Affordable Care Act. All of you get a chance to work with the public, work with constituencies. For the constituencies you work with, how have the Affordable Care Act so far impacted those communities in some of the day-to-day work that you guys get a chance to do?
Well, again, we represent, I'm from the Substance Abuse Mental Health Services Administration, and our focus has been on behavioral health. But we want to stress that as behavioral health is part of an integrated structure, we don't want to divorce behavioral health from hypertension, diabetes, and asthma and other health conditions. But the key issue is that with the Affordable Care Act, in the benefit package, we now have coverage for mental health and substance use disorders and other behavioral health treatments. So that allows us to pursue early intervention and prevention strategies, screening as people present to primary care, screening as the new delivery systems evolve. And we recognize that thus far we do only have 27 jurisdictions that have adopted Medicaid expansion, but those are fairly large jurisdictions, so we have to get people to understand that those services are available and that they need to access those services. Because that's the other thing that we find out is just because you build it, they don't necessarily come. So we want to make sure they're culturally relevant, language specific, so that people understand some of these issues. There's issue of literacy, particularly when English is not the first language, or where parents do not have the opportunity to learn to navigate some of these issues. So we're still working on that, but you're right, the ACA has offered a tremendous opportunity to America, and we need to capitalize off of that.
And I think a point you made too is a lot of folks, when they talk about the ACA, they directly attribute it to the marketplaces that are set up, which are awesome, but there's so much more that goes into the Affordable Care Act too, and I'm glad you got a chance to highlight that. Marco?
Yeah, so there, and there's a fact sheet on the Affordable Care Act and different constituencies that was made available to you all, and so obviously you have some of the actual statistics available, and some of those I'd cite that I think are critical and that are useful is, there have been some real, actual, measurable, tangible results and impacts, and positive ones, for the Latino community as a result of the Affordable Care Act. So, for example, close to 1 million Latino young adults have now gained insurance through their parents' plan because of the expansion of coverage to allow children to stay on their parents' plans until the age of 26. There are somewhere between 8 to 10 million Latinos who now have private insurance who have gained coverage for preventive services. And then there's approximately 10 million Latinos who no longer have to worry about going without treatment for things like cancer or other chronic diseases because of a lifetime dollar limit. And the things I want to pull out from that, in addition to the statistics, I think there's a broader component to this, which I think is really significant in terms of the work and the feedback we've heard from the Latino community, which is because of these expansions, there is, going back to sort of my earlier point about sort of the stress levels, there is significantly less fear and concern about what to do if a person or one of their family members gets sick, because there are now those barriers have been removed, and that is pretty significant. Latinos and my colleagues on the panel who are truly the experts in this area can corroborate and or correct me, but my understanding is that Latinos sort of prior to all of these expansion of coverages, were far more likely to do emergency room visits and not to do regular care visits to primary care physicians, right? And many of you in the audience are nodding your heads because you know this work. And one of the reasons for that is essentially because of a lack of coverage, because of concern about a lack of coverage, because of concern of the economic impacts of receiving medical care with little or no coverage. And as a result, people simply avoided going to the doctor. And as a result, now people feel comfortable enough to come forward and go to the doctor early, right, as Dr. Arce was saying before. And so that, I think, has been really tremendous in terms of just the psychological kind of impact in addition to the actual tangible impact, in that people no longer fear getting sick as much, and therefore are able to really sort of focus on looking after their families, taking care of their community, and contributing to society.
So, one of the challenges that we generally face with the API community is the myth of the model minority. And so I think certainly there were expectations or perceptions that APIs were insured or covered before the Affordable Care Act, and that certainly was not the case. One statistic, for example, 1 in 4 Korean Americans were not insured. So we've seen a real, I think, expansion of coverage to the community. 8 in 10, I believe it was, Asian American Pacific Islanders were eligible for financial assistance through the various systems, which was incredibly important. And I think we've seen both through the numbers that we have, which are not great, but the data that we do have, and also anecdotally, that the enrollment numbers were quite high in the API community. And I would say a lot of that was actually very much thanks to the work of community health centers on the ground that were doing the really hard work of walking people through paper applications, doing it in language when needed, sometimes taking hours to do it for each person, and explaining to them what a deductible is, how does the system work. But I think as a result, we've seen, as I said, tremendous coverage to the community. With the LGBT community, our data is not great because in a lot of places we don't collect this information. What we do know from surveys is that 1 in 3 lower middle income LGBT people is uninsured. And I think one way to really put sort of a point on the challenge in this community is if you look at where the bulk of, for example, same-sex couples raising kids they're mostly in the South. These are the same states that are not implementing the Affordable Care Act, that are not expanding Medicaid, that don't have marriage equality, and don't have workplace protections. So we have a whole bunch of stuff happening at the same time, leaving a lot of people in our community really vulnerable. And so, again, we're trying to do our best to reach out to folks and get them enrolled through efforts like Out to Enroll. And we've been doing a lot of work to educate the community about why this matters. For example, under the Affordable Care Act, you can't be denied coverage because of your sexual orientation or gender identity, which seems like the kind of thing that we should have had a long time ago, which we didn't. But it's an important step, and so we're going to keep getting the word out.
Anxiety, depression, and stress. 3 things that are terribly underdiagnosed in men. And that leads to an increase in suicide rate of 4 times the general population. Certainly something that we don't necessarily think about. I'm blessed to be on the Agenda Prevention Commission, the ad hoc committee in the great state of New York, by the way. I am from one of the friendly states. I'm from New York State. We've had great enrollment, and we've had good ACA results. But we need to do still more. And because of the enrollment increase, we're seeing more men get earlier attention than prior to ACA. So it is becoming a bigger deal, and I'm glad we do have healthcare reform in this country.
I have one more question for panelists, but let's go ahead and go around and start getting some questions from the audience as well too. My Brother's Keeper, again, we're talking about young men and boys of color and some of the work that we can do in these communities. When we speak specifically about men's health, and Gautam kind of got to this point earlier, how can we make sure that we are incorporating men's health into the work that folks in the advocacy community or that are doing all around the young men and boys of color work? How can we make sure that men's health is a part of that? And what are some of the things that we need to make sure, to your point about some of the things that are not detected as much, what are some of the things that we need to make sure are getting out there? What are some of the things that need to be pushed out more?
I think the main message that we need to get out there is get out and find yourself a good doctor. Yeah. Someone that you can develop a relationship with. Not just a doctor who will just take your insurance and you don't have any other choices with. Find someone who will take the time to develop a relationship with you, and your health will be in better control. You'll be able to do a better job. I know we're preaching to the choir here, and everybody here is up to date on their health. But in across America, this is not the case, and we need to create more awareness so that the message can get out there. Look for a way of establishing a relationship with a physician. Keep regularly scheduled appointments. In my practice, often enough, the male comes in because the wife is the one that's bringing them in. They'll sit in the room with them, make sure that they tell me what they're supposed to tell me, and then they step out. But I don't mean to create a situation here, but if a female breaks her nail, she's in my office in a heartbeat. Doc, I broke my nail. Can you tell me why? But to get a male to come in takes quite a bit. And I think we just need to get that message across. You can take care of your own health. You don't have to depend on somebody else's schedule. Men have excuses for everything. They're hard workers, but they have excuses to come into the physician's office and get help. Now with ACA, there is no excuse. You can get in there and get that message across.
So I will use the opportunity just to underscore the importance for the AAPI community for data disaggregation and for the LGBT community for data collection. So both very important things that we need to work on. In terms of the tools to get people involved, I mean, I would, again, highlight what I said at the top, which is going to people where they are. So whether it's making sure that you're speaking the language that they speak, or whether you are familiar with what it means to be, for example, LGBT or T, I think those are the kinds of tools and approaches that we just need to do more of and share best practices.
3 quick things, I think. One, I want to echo Gautam's point, and in reference to the Latino community, which is that in our case there is, I think, some more data that's being collected, but I think there is a continued need for data analysis and data dissemination. So that's something I think that's also, and to some extent disaggregation, even given the diversity of the Latino community, for us to be able to really get a much clearer handle on the dynamics in the Latino community and as relates to breakdown by gender as well. Second is, I think this is an example, I think, where we can all sort of play a part and look. Certainly, advocacy community can raise their voices, research, academics, and so on, but also sort of practitioners. I think there's an important piece, that there's often sort of anecdotal examples of ways in which we can all sort of look to change our practices. And I share it with really from a first-person perspective as a father of a child where there were significant special needs, and there were lots of conversations that I would have that my wife and I would have with medical professionals from all sort of different aspects, from physicians to therapists and everything in between. And it was a fascinating kind of thing that those professionals then repeated back to me, which is that sometimes it requires a bit of an extra effort to draw out the male family member in terms of the conversation, in terms of healthcare. And I think that's something that, again, I would bring up because I was fully engaged. I would go to every appointment and so on, and I would proactively try to answer questions. And these practitioners then said to me, that's not common, and I realize I've sometimes fallen into the habit of just asking the mom, particularly in terms of childcare. And I would just sort of look to the mom and ask the mom, and there would be sort of subtle kind of behaviors that would indicate that sort of they were looking for the mom to participate more in the conversation and not as much. And as we know, there's a need to sort of incorporate, and I think so thinking about how we approach our language, how we approach our habits to help make sure that there's all aspects of this culture of inclusion, this culture of this community of conversation, of current concern and care for health can help sort of expand that vocabulary that we're talking about that sometimes is not as prevalent. And then the third piece, briefly, is relating back to that point about mentorship. Which is a strong push of My Brother's Keeper, which is, again, I think all children, certainly men, but boys and young men, but certainly girls and young women as well, all needed a caring adult in their life. And we know that that's a really significant factor in terms of improving life outcomes for young people. I think including a conversation around health, including that topic into all of those conversations is an excellent example. Asking people what they want to be little kids, what they want to be when they grow up. Asking them how much they're reading, right? Also asking them how much they take care of themselves. Asking them if they are brushing their teeth every night, right? Asking them if they do their regular doctor visits, if mommy or daddy takes them to those. Helping them make sure that that's something that is expected across the board of all children can really help, again, build that culture of care about our own well-being.
Marco dealt with a number of the issues associated with boys or children. I want to stress, and others have talked about the more global approach, but I want to stress that we're also talking about young men. So we want to keep in mind that young men often perceive themselves as invulnerable and therefore don't understand what this whole dialogue is about, because after all, they're healthy, of course, when they're not, but they're healthy. They don't need to go see any doctor. And we need to keep them, we need to think in terms of teachable moments, conditions that bring them to the healthcare delivery system, and the healthcare delivery system using those opportunities to teach about the importance of health. So trauma from sports or trauma from just playing around. It's an opportunity to start talking about good health. It's an opportunity, especially for young men, sexual health, to talk about interpersonal relationships, because we have issues with domestic violence, and the young men who present, since our focus is on young men, there's the issue of violence, frustration, and interpersonal relationships. So we have these opportunities. If we're going to talk about prevention as a strategy, we have to find those opportunities to deal with the male psyche, whether it's machismo, whether it's an American Indian, Alaska Native perception of what a warrior should be doing, whether it's an African American. The key issue, or Asian American Pacific Islander, the key issue is that for young men, we need to look for those teachable moments and exploit those teachable moments in order to communicate the importance of health.